secret of your success is determined by your daily agenda. John C. Maxwell. Welcome to the Guyana Dialogue. I'm your host, Shamiza Ali. Our topic tonight is a conversation on innovative measures, robotic assisted surgery, digitalizing of medical records, AI, being implemented in the health sector. The Guyana Dialogue is being sponsored by a coordinating council of Guyanese based in the US, UK, Canada, the Caribbean, and Guyana. Funding support is by well-known philanthropist Dave Narayan from Dave West Indian Imports. Please welcome my moderator for tonight, Dr. Tara Singh.
Thank you very much, Samiza.
Welcome, Dr. Tara. Our panelists tonight are Dr. Vishnu Bisram and Dr. Sanjay Ramkisu. Our guest tonight is the head of internal medicine and cardiology. Please welcome Dr. Mahendra Carpen.
Good evening.
Good evening and welcome, everyone. Dr.
All
Tara,
right.
please go ahead.
All right. Thank you. This evening, we are very pleased to have with us a distinguished Guyanese physician, Dr. Mahendra Carpen, who is an interventionist, cardiologist, as well as an electrophysiologist. Perhaps he can explain what that is, the last concept here, electrophysiologist. But we are very pleased to have you. We know you're very busy. Also, Dr. Carpen is a senior advisor on health to the president of Guyana. I think he also is a consultant. You can correct me if I'm wrong, to the Guyana Heart Institute, the Caribbean Heart Institute. And I believe also you, apart from being a consultant, do you also practically involved in doing surgeries as well, heart surgeries?
Good evening, guys. Thanks again for having me. It's a couple of things. I am the former head of medical services and cardiology at Georgetown Hospital.
Okay.
A good friend of mine, Dr. Michael Chin, is now in that role as I do a little bit more in other aspects of medicine at the Ministry of Health and the Office of the President. And cardiac electrophysiology is the field of cardiac sciences that deals with the electrical system and the rhythm of the heart. And if you consider the heart as like a house, it has a plumbing system, which the interventional cardiologists tend to address, and it has an electrical system, which the cardiac electrophysiologists address. I do interventional cardiology and cardiac electrophysiology. And cardiac surgery is a little bit different, which involves the use of instruments to cut and open, etc. We do more minimally invasive stuff to address conditions and diseases of the heart.
Thank you very much. Before we go and talk on these subjects like the advanced technology or innovation in the medical sector, would it be possible that you can give us a general overview of the state of the health sector in Guyana? A general overview, what you see as the most significant challenges ahead?
So this is probably the most exciting time in Guyana's history for several sectors. And leading this charge is the health sector in keeping with the vision of President Ali. Again, have a world-class healthcare system second to none. We are starting from a significant way back from all levels of the healthcare system, from primary healthcare, secondary healthcare, and advanced tertiary healthcare as well. And the first goal, of course, in all things medicine, is prevention. And I'll talk to you about what we're doing at that level. I'll talk to you what we're doing at the regular community level for secondary healthcare and what we have done recently in tertiary healthcare. At the primary care level, we have embarked in collaboration with the Mount Sinai Hospital on a program that started screening of our children from primary school. So each primary school child will now be screened for things like mental health, dental, eyesight, for chronic conditions, their blood pressure, blood sugar, weight, etc. All of the normal measures that have an impact on quality of life and length of life. In fact, this is a success story for us that we have over 90% of children in the primary school system that are already screened. And we've moved on to the secondary school system as well, where we are maybe approaching 50%. That program started a little bit later, but I'm confident that we will get to close to 100% of the children that are screened. This is important because the countries and the societies that have the best health outcomes, the most economic yet diverse and available health systems, are the ones that monitor their citizens from cradle to the grave. And that's important because we can plan health policies, we can allocate resources, we can know what to anticipate from a population level as well as an individual level. And once you have the data, even if you cannot intervene and make the right treatment at this stage, with the pace at which science and healthcare is advancing, there is hope that within a short time, that things that are not treated right now can actually be addressed appropriately. All of the fancy and more advanced techniques of genetic therapy and gene splicing and all of the more advanced things that can be done are happening at a much faster rate now. There's an accelerated rate of healthcare development. This at the primary level, this is combined with an aggressive rollout policy of the vaccination and screening program. We have made a conscious decision in the government to address four main cancers: breast, prostate, cervical, and colon cancer. And our programs are tailored towards screening and early aggressive intervention for these pathologies. Now, we have done so at a national level. This is supported by government programs such as the healthcare screening vouchers. We have done vouchers for each citizen or each woman in the society to have pap smears done to screen for cervical cancer, screening for breast cancer, for the men to screen for their prostate cancer, etc. So, and these are all incentivized programs so that it doesn't really cost people out of pocket expenses. So we have tackled that as well. There's also an aggressive rollout of the vaccination program and delivery of medicines to remote areas. If you're following the news, most recently, there was a landmark development in Guyana when we were able to deliver much needed medications using a drone that was flown from a central area to a remote village in the interior. That's a proof of concept that yes, this can work. And now that's set to roll out much more aggressively to other communities where it's difficult sometimes to have access to proper health care. Complementing that is an aggressive use of telemedicine, where community health workers at those health centers, far out regions in Guyana, can have direct access to specialists in Georgetown and the coastland. And so patients can have real-time consultation without having to leave their villages, and they can have the best medical opinions available. Sometimes that is also supported by our partners overseas from Northwell, from Mount Sinai, even from India. So we have been building a network, recognizing that we need help in some areas, but a lot of this is innovative approach to how healthcare is delivered. At the secondary level, we see that we have built 6 brand new regional hospitals, and those hospitals have been equipped with things up to CT scans, and the people around there in the population centers are making use of them so that early intervention, early diagnosis, early treatment is available. And these hospitals are strategically positioned that the major population centers are within 1 to 2 hours access to these hospitals. So we are creating within the country this hub and spoke model of healthcare delivery, where these hospitals serve as a hub, and the spokes are all of the health centers and smaller facilities around that catchment area. And ultimately, of course, Georgetown Hospital is the final referral center in the country. For advanced healthcare and tertiary level, the most magnificent thing happened recently where Guyana introduced on its 60th independence anniversary the science and technology of robotic surgery. Now, robotic surgery has been around since 1985, but we decided we were going to blow that door wide open recently. And so, what we did was the longest ever recorded tele robotic surgery. And I'll explain that to you in a little detail. Imagine the doctor and the primary robot are actually in Georgetown Hospital, and the patient and the secondary robot were in an operating room in India. That was 20,000 kilometers away. And as the surgeon was using the robot in Guyana to operate, the robot in India was following, just like a telephone call, just like data being exchanged online. Now, that was successfully done. The surgeons were very pleased with the result, and by now the patient is home, and the surgery went well, uncomplicated. It was a demonstrate that Guyana has signaling that we are entering into a new era of healthcare in our country. Following the success, and that was not a simple surgery. Actually, it was a bypass heart surgery. And instead of traditional approach where you open the chest from the middle and then access the heart, this was done by inserting a couple fine tubes like the size of a pen through the chest wall between the ribs, and that gives you proper visualization of what the heart is doing. And from there, you were able to operate. The recovery time for patients are better. The surgical complications, discomfort is better. People go home earlier. And if you consider that each hospital day in a cardiac ICU or a post-operation ICU can cost anywhere between 6 to 12,000 US dollars. Sending home the patient 3 or 4 days earlier save a lot in the long run. Now, following that successful tele-robotic surgery, we actually had on-site robotic surgery at Georgetown Hospital, where a patient who was born with a hole in the heart actually had the hole fixed by robotic surgery. The surgeon and the robots were both in. And of course, since then we've done hernia repairs. We're planning on doing some gynecology surgery, more urology surgery, and so that the team continues to have more and more exposure and practice so that they become experts at the technology. So you can see where Guyana has been, where we are, and where we're headed. And it's actually a very exciting and transformational time in our history, particularly in the area of healthcare.
Thank you very much, Doc. Before I pass you over to Dr. Sanjay, I just want to ask you another question. How widespread is heart disease in Guyana?
Guyana, uh, there was a time in the early 90s and early 2000 when our neighbors in Trinidad and Tobago were considered as the heart attack capital of the world. And it was actually said that heart disease was a bigger problem than crime. Unfortunately, I think Guyana is now taking up that crown. And it's an unwanted crown where heart disease is rampant in our country. When I first came back to Guyana in 2012, having completed advanced studies in Toronto and Boston, I used to see a lot of heart attack patients coming into the hospital maybe in their 50s, 60s, and 70s. Unfortunately, now it is a very common thing to see the 30-year-olds, the late 20-year-olds, early 40-year-olds coming into the hospital with heart attacks. And that is quite an unfortunate progression and development for our country, because that's the time when people are, their best in terms of productive years. That's when they have young kids in school. That's when they have their mortgages, or they're going to now qualify for mortgages and they have debts, etc. So it's a very worrying development. Heart disease in Guyana, like the rest of the world, continues to be the number one cause of death in all population. Unfortunately, Guyana has not been spared.
Have any analysis been done as to why this is happening, this low age groups?
We don't know yet what the common denominators are, but we could make some assumptions based on what we do know. And I believe some of the lifestyle changes that would have occurred in the last decade have not been in the best direction. People walk less, people eat more out of the home, and so therefore they're subject to all kinds of additives in the food that they eat. Fast food is becoming more and more prevalent in Guyana, and when people, even when you take public transportation, you insist on the bus stopping exactly in front of where you want to go. There's no bus stop to then walk 50 yards or 50 meters or 100 meters away. And nobody has, well, very few people have kitchen gardens now. And the most important thing, unfortunately, though, is the lack of screening in early age. And that's what we're hoping to address by doing screening from primary school, secondary school, etc., so that we have a healthier, more health conscious population who can take care of themselves rather before symptoms occur, rather than waiting until something catastrophic happens and then turn up to hospital.
All right, thank you very much, Dr. Sanjay.
Thank you very much, Doc, and good afternoon to you, Dr. Carpen. Good afternoon to our viewers. It is indeed a pleasure to be with you in another program here in the Guyana Dialogue. And thank you very much for the hard work you're doing in Guyana day in, day out. I know a few weeks ago I had reached out to you about a particular patient and I got you on the first call. So thank you very much for all the hard work you're doing. And thank you again for giving us a good bird's eye view of the healthcare progress that we're seeing in Guyana, putting it nicely in a capsule form for everyone to really understand. My question to you this afternoon, where do we stand when it comes to digitalization?
Okay. That's an excellent question. I think that's our immediate challenge, but it's also something that's been addressed about 2 years or so now. We are going towards digitalization for all our electronic medical records. Right now, the Georgetown Public Hospital, which is the largest hospital in the country, is being used as the pilot. And that program is being rolled out, and it's already in place, helping patients with scheduling, etc. I don't know if you're familiar with how things happen or used to happen here. It's very common for people to arrive at the hospital at 5 a.m. and not be seen until 10, 11 a.m. again. And that's because there was no proper appointment system. That may still happen. I'm not denying that, but it's happening less and less. People can actually make appointments. Sometimes they can make it online and they expect to see their doctor and be reviewed at that particular time. In one of the major or larger clinics in the city, the Festival City Health Center, that's something that's been happening more frequently and more regularly. of course, with like any pilot project, there's always going to be some hiccups that we're working through. But the goal and the aim is to ensure that all our patients can have a more effective and appropriate use of resources so that they don't have to come and wait, they can schedule. And one of the next things that we'll be able to do is to have patients access their results online so that they can have protected data as well, but also that they can have this to be shared, copied for their own personal records.
Doc, if I can do a follow-up here. We're looking at one EMR system, or we're looking at different systems?
Now, this is supposed to be a single system that is government supported, and it's supposed to be rolled out in an integrated fashion that involves both public sector and private sector, so that a patient can move seamlessly between public and private sector and not have to suffer any discrepancy with their medical records. And all of this actually is going to be tied into what we are doing with our digital ID cards, where the health record of a patient is actually linked electronically to their ID cards. And of course, this brings up all kinds of other issues of data protection and accessibility, etc. And of course, so that's what we're spending our time right now to do and try to make sure that nothing is compromised while we roll out technology.
It's very good. Thank you very much.
All right, Dr. Vishnu.
Yes, sir. Well, welcome again, Dr. Carpen. I think it's the first time I'm engaging you here. We met before as well. You mentioned something that excites me, and quite a number of things I want to raise with you. Screening of the students. I presume at some point in time we're also going to start screening adults. Now, the records of both the students and adults that presumably will be done soon. Is there any kind of statistical analysis that from which, you know, the privacy doesn't have to be compromised, from which medical experts, analysts, social scientists can have access to at some point in time in order to do some studies that these are the issues and problems, like you mentioned just now, heart disease among young, that we would be able to see these kind of analyses and perhaps plan how to address them?
Yeah, so that's the ultimate goal of doing all of this, so that we could have better public policy, better health policies for the country. So the information we gather now will be used by the statisticians, will be used by the policymakers, etc., to understand how to allocate resources, what programs need to be implemented, what are the strengths, what are the weaknesses. And I'm certain that while the access to data may be controlled now and maintaining some kind of anonymous records, at some point in the future, with the proper permissions and regulatory steps in place, researchers like yourself and others may be able to access all of this data to actually do research, to do publications, to theorize, and to put programs and stuff in place that could actually help the population and help the country in moving forward. So the goal of all of this is not just to collect data or to, you know, make things easier, but it's actually how to plan for the future. What we do now, what we're collecting now, the information is actually going to be used for generations to come in terms of how we allocate resources, what we plan, and how we use what we have.
Doc, very often, you know, somebody dies and the people say, "But I didn't know how he dead, man." Like, but just like that, Bram by dead. Are these kind of information being, you know, kept digitized and so on, so that we will know that these are the kind of pathologies that led to death?
So, you know, sudden death is something that I've raised in the public forum not too long ago. There is a well-known entity in cardiology and medicine known as sudden cardiac death. And a number of these persons, unfortunately, who die suddenly would fall into that category. Even on postmortem, however, you may not be able to find the exact cause of death. But the sudden cardiac death, for explanation purposes, is actually an electromechanical malfunction of the heart. And that is precipitated by many things. It could be from sudden blockage, sudden loss of oxygen through to blood clot in the lungs, etc. So, whatever it is, it causes the heart to malfunction in a way that it goes into something called an abnormal rhythm or an arrhythmia. And when it goes into this arrhythmia, it's not able to pump in a coordinated fashion. And once it doesn't pump blood out, then no blood goes to the brain. And when no blood goes to the brain, there's no oxygen. People start to feel dizzy, pass out, fall down, etc. And if the heart doesn't regain that coordination to contract, unfortunately, patient die. Now, you've seen TV shows, movies where people are rushed into the emergency room, put on a stretcher, you put the paddles on the chest, you hear somebody shout, clear, zap, and then they might wake up. Sometimes they don't wake up. Well, that's the dramatic representation of what happens. Unfortunately, even in the most advanced societies in the world, only about 10% of patients make it to hospital in time, and the rest don't. So the trick to prevent that is to identify those who are at risk and then to take the appropriate steps to intervene so that it doesn't happen, or if it does happen, that there's something implanted, something like a defibrillator that we implant in patients that could do the work of the shock before you get to a healthcare personnel.
And if Dr. Tara intervenes, people always ask, "Why? Who's Mahendra Carpen? Where you from?" You want to answer that question?
Um, I'm Guyanese born and raised from Albion, Quarantine, and I've always been proud to be the son of a cane cutter and a housewife, and fortunate to be one who was privileged to have an education and come back home to do what I can. One way or the other, my path has led here, and I'm actually very pleased and happy that it did. So I'm an ordinary, humble person like everyone else, just trying to do my part in the world.
Dr. Tara?
All right. Thank you very much. I I have a few questions for you. Unrelated to heart. What I found over the past couple of months, I've been doing what you call a haphazard sample of Guyanese who are suffering from dementia. And I found that almost every family I spoke to, they know someone who's suffering from dementia. I know that Columbia University was doing a study on mental illness and suicide. And the minister told me, the Minister of Health, that that report is due year end. It has not been submitted yet, but I see a trend where dementia is becoming more and more, um, I don't want to use the word prevalent, but more greater incidence of dementia now. What are your thoughts or experience with this?
I don't have specific data for dementia. However, the same things that contribute to cardiac disease, to kidney disease, the same underlying process oftentimes contribute to dementia and mental deterioration. And those are the things we call, microvascular disease or polyvascular disease. And it's a well recognized entity, the microvascular dementia. So, what that really means is that the things that affect your blood vessels, and blood vessels are prevalent from head to toe, the things that affect your blood vessels, like the diabetes, high blood pressure, bad cholesterol, smoking, all of those other things, once it affects the blood vessels to cause damage, blood vessels from head to toe are affected. So it is quite likely that the same things that are contributing to heart disease also contribute to brain disease. As people are living longer and as you're controlling more and more of these risk factors, there is going to be a time when you start to see a more uh, prevalent manifestation of these conditions. So it's not a surprising thing to recognize more dementia. Guyana, in particular, unfortunately, has a very high unfortunate rate of suicide, and it continues until this today. We have persons, particularly in the rural and farming communities, with easy access to fatal substances. In circumstances under depression, whether it's situational depression or endogenous depression, with easy access to harmful substances, under the emotional stress, people make rash decisions. And unfortunately, some of the things that they do, some of the things that they consume are irreversible or cause irreversible damage. And we we recognize this. We have programs. Many groups have continued to show interest to help with all good intention. However, despite all of that, we still have a worrying number of persons who resort to suicide.
Is there any link between heart and mental illness, congenital link, some hereditary factor involved?
Yeah, that's an interesting question. Nothing seems to come to mind immediately because those kind of things would be extremely rare to have that direct genetic link congenital issue. However, the acquired cardiac disease, the acquired mental disease, whether it's dementia or any of that, they seem to have a common underlying risk factor profile, the same things that I've spoken about earlier. So the same things that can cause heart attacks are the same things that can cause stroke, the same things that can cause memory loss, etc.
All right, thank you. I think that Shamiza, it's time for a break.
Yes, we'll take a break and we'll be right back. Quick reminder to encourage all our viewers to check out Dave West Indian Florist. He catered to a lot of different floral needs. Dr. Tara, please continue.
Yeah, we can see Dr. Carpen.
Dr. Carpen.
You're the, oh,
There
Right
he
here.
is.
yeah. Before I ask you to comment a bit further on the role of AI in medicine, you mentioned about 6 regional hospitals. Are they adequately staffed? Because I know attrition rate, especially among nurses, has been pretty high. So if you can comment on that, please.
Yeah. So thank you very much. And that's an important, very practical question. The world is grappling with a shortage of healthcare workers. And I think since the COVID pandemic, we've seen a lot of persons opting out of healthcare and moving away from a career in healthcare. So the intake, for example, at nursing schools and allied health schools have been significantly affected. And so therefore the product, the output at the end of it is less. We in Guyana have not been spared by human resource shortages, not just in healthcare, but every field. However, the ones that we do have and the ones that we are able to retain are among the most dedicated people, hardest working under trying, difficult circumstances, oftentimes, way below what they are actually worth or valued at. And those are people who we continue to be very grateful towards. Those are people we owe a lot to. The ones who make that decision, who uh, contribute to our healthcare society, the unsung heroes, those that are not seen, the ones that are in the background. And they're all levels at the healthcare systems, from the porters to the surgeons, the nurses, technicians, pharmacists, imaging people. They're all key to having a working system. And while we have challenges, I'm pleased to let you know that we do have all systems that are working. They may not be working perfectly, but they certainly don't do harm to patients. There are significant efforts being made to continue to train people. We have many persons in nursing program, allied health programs. We have training in nurse practitioners that are ongoing. And a lot of these are persons who are from remote areas that are going back to the remote areas in their villages and far-flung regions to be able to provide health care and be the essential link to providing a better quality of care, utilizing technology and overcoming challenges that exist.
Hey, Doc, if I could ask related to that, are we recruiting foreigners or even Guyanese abroad?
So there has always been an effort to recruit persons. Now, there are certain realities that we have to face, not just in Guyana, but around the world. And in order for you to get somebody to move from a place that they're comfortable to somewhere else, they have to be properly incentivized. And it the package that we use to attract persons has to be something that they're interested in and something that we can afford. And so finding that balance is always a challenge. And we can't import somebody to do the job that a local can do, but then you're going to pay that imported person more. It's actually against the laws. So we have certain constraints.
Mhm. All right. Thank you, Doc, for that explanation. I now pass you on to Dr. Sanjay.
Doc, thank you very much. What's the update with the new Women and Children Hospital?
Yeah, so the Women and Children Hospital continues to move along. The shell is almost completed. They're doing some internal works. There's a little bit of a snag in continuation. We may have to change some of the strategies that have been in place towards completion. But while that is happening, while there's some delays in the actual finishing of the building of the teams that will work in the hospital continues. So, the Georgetown Hospital, the outlying regions that are expected to defer more to the specialist hospital, maternal child health hospital, have actually been building the working teams from technicians to doctors and nurses, etc., on the outlying hospitals and the Georgetown Diamond Hospital and more, so that when the building is completed, the functioning teams will just be transplanted from point A to point B and carry the same synergy to provide the services for Guyanese.
It's very good. That's amazing. I'm happy to hear that we're making small progress in the right direction here. Um, I'm not sure if Dr. Vishnu has any other questions, but I wanted to ask a quick question. When someone gets diagnosed, unfortunately, with one of these cancers, can you just walk me through if someone from Skeldon or Crowwood Creek get diagnosed with one of these cancers? How is it go? How is the patient cared for from diagnosis to cure?
That's a tough one. And I'll be the first to admit that there's a number of gaps in the system. But while there are gaps, we have a lot of success stories. And we have the provision of screening in the communities. And once something is picked up, then we utilize the hub and spoke type of philosophy and model so that patients are referred to the major hospital region. If they can't be adequately addressed there, whether it's by surgery or chemotherapy, then they're referred to Georgetown. And here we have a very robust program that runs every day with chemotherapy, blood transfusions. We have uh, radiation therapy as well. And that's all being upgraded. There are a couple of gaps that I think if we're going to look at cancer care in particular as a specialist level, we need to have more investment in things like more advanced imaging for screening and follow up on monitoring of therapy. For example, we would need to have something like a PET scan in the country, which we don't have yet. It's a very advanced imaging that can pick up, as you know, a spot of cancer, like just a hot spot. But those are the things that we are heading towards. I know that there's a deliberate policy from the level of the government to incentivize the private sector to take up some of these challenges, because not everything is going to be a government development. And so, if you yourself or others who might be interested in exploring that kind of involvement in Guyana, we welcome our diaspora and third parties to become involved in the development of Guyana.
All right. I want to take you back, Doctor. The point you made earlier about lifestyle changes can affect our health. Um, I can see this very vividly in the heavy consumption of alcohol and to a certain extent the use of drugs. And when I say drugs, I'm talking about the narcotics. And that I was told, and the new thing with the kids now vaping is becoming prevalent in Guyana as well. So I don't know. I didn't carry out any research, but what you can say about these.
So, and a very important and evolving habit in Guyana. It's not an unusual thing to have young people using these substances or even older persons. Alcohol has always been there, people always using alcohol, and a lot of times it fills the gap with boredom, etc. But now we're seeing that significant increase in the number of persons vaping. I believe there might be a small movement away from tobacco smoking, but that is unfortunately offset by increase in vaping. And that's a particularly dangerous and worrying thing for our young people, because as we know, the effects are not good. Vaping oftentimes, it's not inactive. It's not an inert thing that is used. The chemicals that are contained in the vape actually are very active substances. They can cause constriction of the blood vessels. They can lead to hypertension. They can cause damage to the inside of blood vessels, promoting clots. They can increase heart rate. So the risk for heart attack, hypertension, stroke, all of those things are real. We don't know yet what level of influence that has on the number of younger persons who are coming into hospital with serious heart attack and stroke, etc. But it's an important thing for us to recognize at this stage, and perhaps in the near future, we might have legislation that actually seeks to regulate or restrict the use, importation, and prevalence of these kind of things in Guyana.
So right now, vaping is not controlled by any legislation.
No, it's really not under a controlled program. It's unfortunately too prevalent. Even in the malls, you could see the regular kiosks. You could just go and pick up whatever vape you want.
I years ago when I was young and going to primary school, they used to give us a lesson on hygiene and sanitation, and I don't know if they have those programs now in schools, but do you think there'll be a good idea to introduce some basic concepts of health, lifestyle, etc., as a subject in school,
I think,
primary?
yeah, there is uh, there are programs and subject areas within the school system that deals with these healthy lifestyle, healthy habits kind of stuff, and civic duties, etc. And I think the government in its plan wants to introduce a subject that deals specifically with civics and personal responsibility, community responsibility, etc. for students. So training and teaching young kids how to be more responsible members of society, how to live within a group, and how to function within society. So I believe those will be quite important interventions, quite important programs to have to produce a more rounded and more socially adaptable citizen in the near future.
Some patients have been complaining based on public reports that they had to wait a long time to get treatment, or the attitude of nurses was not too pleasant. Is that a common thing or a one-off situation?
Well, we've all um, heard stories. And now with social media, etc., people are much more able to express their frustrations, and it's an outlet that perhaps might even be therapeutic for some people to express the frustrations and negative emotions on those platforms. What I can tell you is that, despite all of those challenges, you might find a disgruntled healthcare worker from time to time that unfortunately it comes out and it's directed towards the patient or the customer. But by and large, the vast majority of healthcare workers do above and beyond to be helpful to patients in very stressful and trying circumstances. So I believe and I'm convinced that the complaints of bad attitude and mistreatment, etc., are more isolated and individual rather than systemic.
Okay, finally, before I pass on back to Dr. Sanjay, can you please give us a little lowdown on the work of the Caribbean Heart Institute? Are you still linked to that in some way?
So, the Caribbean Heart Institute, as you know, is a product as a brainchild of then President Barry Jagdeo, now Vice President, and Guyanese diaspora out of New York and Toronto, Dr. Gary Stevens and Mr. Romeo Vandenberg, and a team of investors that they pulled together. And this program was started in 2006 at a time when, not too many people were interested in becoming involved or in cardiac care in Guyana. In fact, The years prior to its establishment, government had a budget to treat maybe uh, a number of persons overseas for cardiac care. They had a $500,000 budget, and that was only able to stretch for 10 patients. So there's always going to be an issue of who you select to send overseas, etc. And do you get value for money? And is it in the national interest to do certain things? Based on that need, President Jagdeo at the time and the diaspora decided that we could actually do this in Guyana and it would make sense. Believe it or not, there were some persons from the Caribbean who actually traveled here to Guyana to dissuade Dr. Jagdeo and Dr. Leslie Ramsamy and Dr. Luncheon at the time from doing this. And I believe they had all good intentions and concerns, etc. But we've moved from that stage in 2006 or 2007, where we did our first cardiac procedure. Now, last year, in collaboration with the Ministry of Health and Georgetown Hospital, the Caribbean Heart Institute did almost 1,000 angiograms with over 650 stents. We did about 100 pacemakers, about 100 open heart surgeries, 58 and I think 75 ablations for heart rhythm. It's, so, and the cost is significantly less than if you had to treat those patients anywhere else or bring in specialists to do so. Out of that initial program, we have now grown to the stage where we are now in collaboration with Northwell Systems in New York, offering cardiology residency training right at Georgetown Hospital. That means we can train our own cardiologists at home so that in the near future, every major population center will have access to a cardiologist. We will train them and place them there so that people in Saudi, for example, don't have to travel to Georgetown to see a cardiologist. My family in Skeldon don't have to come all the way to Georgetown to see a cardiologist. They could have one right in Skeldon, one in Rosal, one in Yamsland. And that is the idea, that we're training our people to fill the needs and to fill the gaps that we have. So all of that started way back in 2006 with a conversation that started Caribbean Heart Institute. And now it's grown into a much stronger collaborative effort between the government of Guyana, the Heart Institute, the Georgetown Hospital, so that it's the primary center for invasive cardiac care in the country.
Thank you, Doc. Dr. Sanjay? Dr. Sanjay. This is gone off the screen. Dr. Vishnu, you're there?
Dr. Vishnu is not here. And I think we just lost Dr. Sanjay.
And Dr. Sanjay just lost. Okay, let's...
Yeah, I got disconnected here.
Okay, go ahead.
Thank you very much for that quick update, Dr. Carpen. At the time, what would you say, how many cardiologists we have in Guyana?
At this,
approximately.
I think we have about 12 cardiologists in Guyana, counting private sector as well. And there's seven in the public sector, 7 or 8 in the public sector. When I came back, I was the only one in the public sector, and there was one in the private sector. There was 2 of us. And so I was in the public sector by myself as a cardiologist for about 8 years. And then my colleagues started coming back after finishing training.
It's very nice. Doc, you want to give us a quick update? I know we're doing a renal transplant. How is that working out?
So every area in medicine is showing improvement. And we're lucky that we have Guyanese who we could consider, champions of causes. And so in renal transplant, I think a couple of months ago, they were actually able to do first in Caribbean, what they call a chain transplant. They had about a number of persons lined up, and they're operated on simultaneously to transplant from live donor to the recipient. What we've done also in the background to facilitate all of that is to put the right legislation in place. We now have a solid organ transplant committee that is headed by very competent people, and they have access to all of the resources internationally as well that can help them with developing the program. So the program is moving along. It's advancing. It's developing. It's expanding. In fact, we are also doing transplants on a limited basis for persons in the Caribbean. They actually come here and have their kidney transplants done. Once they can arrange their donors, etc., they come with them.
What about kidney transplant?
Yeah, that's the one we're talking about. This
Okay.
renal transplant. Yes.
Okay, Vish, your last.
Yeah, I'll just make a. I have some points to raise. I used to teach a class called health ed and hygiene in addition to civic education. I think it's very, very critical that we introduce these classes at the public school system all over Guyana, so that we could move kids away from those who are thinking about smoking or and other sin activities, so that they will understand the consequences of smoking, alcohol consumption, and so on and so forth. And it is to the benefit of the entire society in the long run. So if you have any influence, if you could suggest to the government and to the industry as well, for us to take an aggressive position, even make it as part of CXC if it becomes necessary, because students seem to want to pass 28, 30, 40 subjects these days, so that we could get everyone on board about suicide and the other pathologies that you talked about.
Yeah, so one of the things that you might be aware of is that we have an active discussion ongoing about the introduction of a subject in school, perhaps at the secondary level, called civics, where, all of the things that you talked about there, that will try to create and enlighten a more polished, rounded citizen for the society. So it is indeed a very good idea, and I believe that that's why it's in discussion at the moment.
So most of the things we've been talking about is dealing with treatment or quality care. What about prevention? And I know you touch upon that briefly. And the teaching health lessons in class might be one of the preventive measures that we can take. I know a doctor friend of mine told me the modern emphasis on medicine now is to go to see a doctor whether you're healthy or not, and to find you healthy is to keep you healthy. Don't wait until you're sick to go and see a doctor. So, what are your views on that?
Yeah, so that's absolutely very important. Early screening, and I believe, we have an opportunity in Guyana where we're trying to make it as less cumbersome or as least cumbersome as possible on the citizens by even removing barriers of cost. And this is enshrined in the government's program of providing health vouchers for screening, etc., to our citizens. And these are cover things like basic blood count, cholesterol level, blood sugar, etc. So every citizen can actually collect this. Is almost the value of up to about $300 when you add the cancer screening, the eyes, etc., to all of these vouchers, and persons are able to get them and go and get themselves checked out and tested. So it starts with early screening. It starts with people becoming more aware of what their health status is, and then, as you say, if they're healthy now, we try to keep them healthy with annual checks and screening. And so that once you have data, if you see somebody's blood sugar is borderline, you know what to advise them. Do some exercise, watch your diet, etc. If you see somebody's blood pressure is different, but we have to always remember, human behavior is probably one of the most unreliable interventions for health outcomes.
Yeah, finally, with the enhancement of healthcare delivery and services, does that translate into longevity, increase in longevity?
Well, that's the ultimate hope and goal. Right now, I think our life expectancy is about 70 years. By early screening, targeted interventions, and better treatment of patients, what we're hoping to is that in this generation we could get to 8 years life expectancy, and perhaps at some time in the future to rival the Japanese to get towards 90 and 100. That's ultimately is not just, but it's not just the length of life. We also want to have a quality of life that goes along with that.
Thank you very much, Doc. Shamiza, over to you. I believe you have some questions.
I do, Dr. Tara. Thank you. Uh, Mr. Jailal says, congratulations to the Lord Dr. Carpen for being one of the leading professional medical authority in not only Guyana, but the Caribbean. His first question is, any prognosis on heart transplant in Guyana?
Ooh, that's a big one. Right now, in the entire Latin America, there are only two countries that can do cardiac transplant, and that's in Brazil and Colombia. And the science and the um, practice of transplant medicine for hearts is extremely complex, and we're not yet at that level. And perhaps by the time we get to that level, there might be additional alternatives to heart transplant using mechanical hearts and mechanical supports, etc., rather than having to transplant one human heart into another human.
And then his second question is there any medical issue more vulnerable or prevalent in the rural area versus the urban areas?
Yes. So in our rural areas, we tend to have more challenges with infectious diseases. And in the urban areas, we tend to have a little bit more chronic diseases. There was a time when you would hardly see any of our Amerindian brothers or sisters in hospital with heart problems or high blood pressure or stroke. Unfortunately, that is becoming a more common thing to see now. Maybe they move away from the traditional lifestyle of walking and eating healthier foods from the farms in the hinterland areas, and they're now adopting more of a urban coastal type of lifestyle. Maybe that's contributing to it, but by and large, we still have the persons in the remote hinterland areas being affected more by infectious diseases than on the coastline.
Uh, Loretta Camby is asking, is Guyana equipped to handle Guyanese who would love to return home but have severe heart condition?
The usual standard of care that you would have been accustomed to in certain developed countries are still to be met, like to 100%. But we have had a number of persons returning home now who can have advanced appropriate care than maybe 5 years ago. I have a number of returning Guyanese who are now living here who have pacemakers, who have defibrillators, people who have advanced heart failure, people who have significant blockages, etc. These are all things that we can do here, routinely actually. The things that we can't do is like heart transplant and management of mechanical cardiac support. But all of the other stuff we are quite capable of doing in Guyana for cardiac patients.
Thank you. What misconceptions about heart disease would you like to correct?
Oh, I've always had a pet peeve with people complaining about gas. There, In my line of work, we see too many people with severe heart problems, blockages that they spend months thinking is gas. And every time it affects them when they climb up their stairs, they stop, they go and get some hot tea, and they think that it's the tea that's curing it. No, it's actually the rest. You stop walking, so you stop exerting yourself, so then it goes away. It has nothing to do with the hot tea or so. So this concept of, oh, I'm having heartburn or having gas, and that's why you're feeling this discomfort, especially persons of South Asian descent. I want them to particularly recognize that that's a warning sign too often for significant heart disease. Don't just take it as gas. Don't just think you could take Pepto-Bismol or Tums and that's it. Have it checked out, particularly if you're at ages above 35, 40, you have some kind of risk factors like diabetes, high blood pressure. A lot of people don't even know what their cholesterol level is. If you're exposed to smoking, if you have a particularly stressful type of lifestyle, if you don't get enough sleep, these are all known risk factors. So don't ignore this feeling and just think it's gas. Get it checked out, please.
Thank you for that. Now, are women at risk for heart disease in different ways than men?
So we used to think a long time ago that women have less risk of heart disease, but we found out the hard way that that's not so. Women have all the same risk factors as heart disease. It may manifest a couple years later, but more importantly, it can manifest differently. Men traditionally can complain of this crushing chest pain in the middle of the chest, going up the jaw, down the left arm, sweating, etc. Women often complain about burning in the chest, like gas, dyspepsia in the upper part of the stomach. They have a discomfort, and that's oftentimes something that leads patients and doctors to make the mistake of thinking that it's a non-cardiac cause for the symptoms. And making that mistake, unfortunately, can be fatal.
Oh, that's good to know. Now, my last question is thyroid. Very common among our Caribbean and Guyanese people. Is there any connection from recent research when it comes to heart disease and thyroid?
The connection between thyroid disease and cardiac disease is long established and well known. Persons with overactive thyroid, for example, tend to have a faster resting heart rate and higher blood pressure. When sustained over time, that can lead to significant issues with heart muscle function and heart failure symptoms, and it may sometimes even lead to blockages and heart attack. Low thyroid function goes in the opposite direction with slower heart rate, and people might get dizzy, they get more tired easily, etc. So there's quite a definite link, but it's been recognized for a long time. And oftentimes, treating the thyroid will resolve the cardiac issue or the cardiac symptoms as well.
That's good to know. And I said that was the last question, but I have one more question. What is your advice to the diaspora before you leave tonight?
Stay connected to Guyana. We are already connected, perhaps by birth and genetics, but stay connected. Keep an eye on what's happening in Guyana. There's a role for our diaspora. There's always something that you can do. Even if you're visiting, come back, visit friends, visit family, see what's happening in Guyana. Don't be misled by, you know, information that may not be accurate. Guyana is moving very rapidly, and you can see that touching the lives of every group in this country. And I don't believe that there's any particular group that's being specifically left behind. I think if you put in effort right now, if you have children who have Guyanese parents and you're in the diaspora, you're overseas, it's not a bad idea to get their Guyana passport. It's not a bad idea for you to keep them grounded and, have some connection moving forward with Guyana. You never know when that becomes an advantage to them even if they live in country outside of Guyana.
Thank you. And now we will ask for your closing remarks.
I've said a lot today, but I just wanted to express my gratitude to you, the host, and the panel for the opportunity to share in something that's near and dear to my heart, no pun intended. But hopefully that there's someone who's listening, someone who life can be altered and changed for the better by the information that we shared here tonight. Someone who could have a better understanding of what's happening in Guyana. And when they have the opportunity to share this with others, that they would do so freely and honestly to represent what's happening in Guyana. A lot of challenges may exist, but the work that is continuing, the effort and the dedication of the people here in Guyana is phenomenal. So thank you again for having me.
And then I do see one of our viewers is asking if you remember, she was your neighbor in Guyana, Loretta Camby. Yeah. But with that said, I would like to take this opportunity to thank our guests for being here this evening. Thank you to our panel. And thank you to our viewers for taking the time to be here this evening. Until next time, I am your host, Shamiza Ali, and this is the Guyana Dialogue. Good evening, everyone.
Thank you.
Thank you very much, Dr. Carpen, Dr.